training online. This time it is also an occasion to reflect, discuss on the first training on site module that has been already concluded. And we would like to take the occasion, of course, to present the results, the outcomes. As you know, we are halfway the project. Next week, we will meet in Rome for colleagues that are joining on site, of course, for the JA National Focal Point consortium meeting, and also we will have the occasion then to discuss and participate to the HADEA events. Of course, you will participate also online to these events if you are not joining in presence. And definitely during the consortium, we will be discussing the activities, but also we wanted to dedicate a specific time to focus and just allocate 1.5 hours for this training online in order to also discuss on the results, the outcomes, and to bring back again the discussion on the National Focal Point Profile and the EU4Health Interaction Platform. So I will quickly present the agenda. Please allow me to share my screen. Okay. So today's webinar is the National Focal Point Profile and organization, how it will be designed and how to cooperate together for a community. Of course, as you know, during the dedicated session on site, the working groups that were led by our colleagues from ProMIS, Christian Leorin and Sara Canella, there has been an entire focus on the role of the national focal point and on the profile as well, meaning the characteristics in terms of background, skills, and other resources. So starting from that specific work, then we would like again to focus on the role and on the tools also that we are developing within the joint action. And this is why, again, we want to work together, and through some interactive sessions, we will have 20 minutes more or less to reflect on what it has been done, what we can do more, and what we want to achieve. So after the presentation of the report, the colleagues have prepared a PowerPoint presentation. We want to highlight the results, and already a report has been produced and it has been shared among the consortium, but also with HADEA. And then again, we will briefly present the platform, and then we will work together. There will be a random subdivision, and I would like to thank colleagues, well, all of you, for being active throughout the sessions and in general. So all the participants, of course, and the colleagues from the associated countries. I see that also the colleague Laurence from Belgium, she's joining today. So we are glad that more and more colleagues also from the associated countries are joining. And then also I would like to thank the colleagues that we had the chance to discuss, and they will be supporting the ProMIS team in co-leading this session. And then we will have the time to wrap up, and a referee from the group, the co-leader, will then present the results at the end. And there will be 3 groups, okay? So further details will be shared once we are subdividing it. And now I would like to, if you have already any question now, please go ahead. Otherwise, I will give the floor to Sarah and Christian for the presentation of the report. Thank you.
Thank you, Sandrita. Can you hear me well?
Yes.
Yes, good. Thank you for nodding. That's good. And so in this, we'll be quite fast and furious to present the results, because we collect a lot of information from the workshop that we did during the meetings. And the idea today is just to share with you a little bit of the results and the collection of the results about the workshop. 1 and the workshop 2. So I will present at the beginning the workshop 1, and then Sarah will go on with the next one. So thank you, Sarah, to go next. As you remember, we met the first time, and we were trying to identify the national focal point person, so to create a kind of identity card. And so the first workshop was to understand, okay, who is the national focal point person? What kind of background it needs? What kind of person are we looking at, or we are? And so next one, the first part of the workshop was really to create a kind of profile. There are lots of information already there in other descriptions of the role, what he has to do, what kind of action and activities the national focal point person has to do during their work. But when we were meeting together, when we were discussing together, we saw that there are different perspectives in Europe, not only from the role point of view, but especially from countries to countries. Next one. So, and the first thing was that all of you were agreed about the fact that we need a teamwork concept. So we are not speaking only about one person that has to do lots of stuff, or two of them, but we need to work in a team. So a multidisciplinary experience was highlighted, and different people. So one person, even if he has the role, he needs to be in contact with the different other people that has different also background, and the team approach for sure could help for different activities like project management, international experience in health, public law. We will see that afterwards. But apart from that, the most important thing that emerged from here was that we need to be in contact with other people, maybe also from different offices with different background, just to try to help to doing our job. And about the technical skills, all of you were agreed about the knowledge of a health system, not only a regional or national, but also a European one, and also the management and financing of legal skills in EU laws and policies. That's why we need to be in contact with other people, maybe also from other offices. All about the analytical and communication skills, the language skills are included and part of the technical skills. Next one. And especially they are in contact with the soft skills. We discussed a lot about the possibility of the national focal point person to have nicely soft skills like communication, listening, self-control, etc. But the more important thing that we were talking about was all the thing that is down. So curious, updated, result-oriented, flexible, resilient, communicative, capacity to engage policymakers, and listening and good connection. Another thing that we spoke about was the fact that this national focal point person has to translate all the calls in not only in the language and the national language, but also in a more editable language, something that you can understand, digestible. So another good content about that was that the people are involved not only in telling what are the calls and how to participate, but really translate in a non-technical language. That was quite good. And also another thing was an influencer. So national focal point, all the people were agreed about that it has to be an influencer. So try to convince, to engage, and contaminate all the stakeholders in participating to this call. Next one. And for sure, when we're talking about nice to have, about part of the legal background, was interesting the underlying the matchmakers. So the ability to read the call, understand it, and try to create an interest in the stakeholders. And this is quite difficult to have, or some of you said, oh, I'm not very good on data, or I'm quite new in this role, I'm still learning, but that's something that we want to share, for example, and could be something that link or create a hook to the platform. So the ability to create a share place where, okay, I have this problem, I am not able to do that. How can we solve it? How can we do something? How can we create an interaction, or please help me? So a lots of the national people involved in the workshops were interested also in the sharing, and we saw that also when we were doing the workshop in little groups. Sometimes lots of people were already asking information. How can I do that? How did you do that? What can I say, or what can I do? How to? So that's something that emerged from all the workshops. And next one, I think, is the next. Yeah, the last one, and that's about the responsibilities. And in this part of the workshop, lots of you just say that the role of a national focal point is different in new countries, and we were discussing between one or the other, and most of you are not in the same role, so it has different duties and responsibilities, and the national focal point is part of lots of different roles that a national focal point is doing. So, and that was quite challenging for somebody, because I have also the national focal point role, but it's not the only one. I'm doing lots of different things and lots of things, so I can dedicate partial time of my total time in this. And another responsibility that was quite interesting is that to build this network and share the information in both directions is something that very challenging, and or to create the link with all the stakeholders, to create this network, to create this especially also with the other national focal point people that are doing, or national contact point, so to create this link with others. And that's something that was quite challenging for somebody that is new in the role or is still understanding what to do. And yeah, that's why to cooperate with other national focal point people and to learn and to share things, that was the aim of the platform. And that's what we want to discuss today, to understand how we can manage it to be useful. I think that's my last one. Let's go next. Yep. And that's so now we talk about the organization, and I give the floor to Sarah for explaining the results of that workshop.
Thanks, Christian. So hello, everyone. It's very nice to see you again, virtual. So as discussed, you know that we tried to define during this workshop number 2 how the national focal point should be organized to achieve the expected results. So what we did during the co-design process was to try to define a common standard. So what a national focal point should do, which kind of objectives and activities the national focal point should implement. For sure, you know that the focus is the successful implementation of the EU4Health program. So the knowledge of this program, but also how to transfer the know-how of this program to the target and to beneficiaries. How to set up a long-term strategies and goals shared with all national focal points. And I think that with the answers that we have seen during the workshops, you are very you agree on that. So we will see which kind of goals we should establish. And for sure the synergies which have been highlighted by all of you, and this need to create connections, networking, share experiences, best practices among you. And for sure, the role of the platform will be focused on that point too. And at the end, we have to achieve the long-term goals related with the EU4Health program, the European policies, so achieve the sustainability of health systems, and for sure implement all the instruments and areas promoted by the program. Okay, so as you remember, the first a part of the workshop were dedicated to discuss about ecosystems and the stakeholders. So which kind of stakeholders and ecosystem the national focal point should involve, how to involve them, how to create a sort of cooperation model with them, which kind of synergies with other European funding programs could be created, and the capacity to transfer to the local territory. So about the types of stakeholders and ecosystems, there was a full agreement. We can say that for sure we need to involve the fund institutions. So for sure European DG, European agencies, but also policymakers and governing bodies at different levels. So we have to consider for sure European, national and regional level. All stakeholders related with national care systems, hospitals, local health authorities, but also the part related with the research, so the universities, research centers, and the part related with civil society, so NGOs representing, for example, patients associations, professional associations, and SMEs and industrial players, because they are providing the technologies, they are providing the tools that we can implement. In the co-design process, so how can we involve and make that the stakeholders work together? You have suggested info days, some kind of activities such info days, focus groups, apps, thematic workshops to inform how to create synergies, the exchange of best and good practices, joint events, meetings, projects, and tailored activities to each group target. And as you know, on the platform, you can find all these part of training process, which will be highlighted. And as you know, also with the this JA, we are working on promoting this kind of workshops, webinars, and so on. About the synergies with other European funding, there is the cooperation, for sure, with national focal points and national contact points. You know that there is this meeting that Sandita presented before with the synergies with the other European programs. So it's indeed, it's very important that you know other programs too, not only EU4Health, and how you can create synergies among them. And for that reason, we are working also to promote training on that part and info days. And finally, we have the capacity of transfer to the local territory. So what you suggested was to propose a full cycle approach. So collect data from territory, analyze this data, and come back, give feedback to the relevant stakeholders. And also here, you have highlighted the exchange of best practices to be adapted in local areas. I have to say that there are more inputs that you have produced. I took the most relevant, but there are more that you can read in the report. So I suggest you to go and read very well the report to see also other possible inputs that you gave. Then, as you know, we passed through the analysis of objectives. So the objectives were related to the definition of specific needs of national focal point, the definition of related specific objectives, and definition of the target related to specific objective. So about the needs, there was a huge discussion, I remember, about that and the need to receive good training and information by ADEA beyond the information already published about the EU4Health. So all of you expresses this need to have a more direct contact with agencies, DGs, to know more about the program and for sure to give the right answers to the beneficiaries and help them. And the need to upskilling and reskilling human resources. So it was presented also by Christian. It's very related with workshop 1. And for sure, related also with this upskilling and reskilling is the use of digital tools. And in that case, the tools available related with the program that you can use. About the specific objectives, you have identified the need to inform properly and facilitate applicants with accurate info. And as you can see, it's strictly related with the previous specific needs. So the knowledge that you need to have about EU4Health programs and the capacity to help participants to apply and to increase the number of successful proposals. So you should also have the right skills to support the EU4Health implementation and facilitate the long term, we can say, facilitate health policies uptake. And the target defined with these objectives are for sure funding bodies, so DG agencies of European Commissions, governmental bodies, so ministries of health at national level, but for sure also regional authorities, national applicants who are applying for the EU4Health program, health ecosystems who are going to be included, and policymakers. And finally, we worked on the actions and instruments related with the objectives identified and underlined the previous slide. So here you went through the suggested actions and instruments to create synergies and networking, suggested actions and instruments to support the capacity building, and actions and instruments for tools and services to create a cross-program collaboration. And as you can see, for synergies and networking, you suggested a series of training, so to implement your capacity to create synergies, create communication disseminations, training modules, so having receiving videos training, Q&A session, tailored materials. About the capacity building, you asked for a specific training for European project management and design, finance and project design, which will be implemented soon. Training approach, and also for sure the identification of best good practices to be shared, and informal and practical training. And finally, about the common tools, you identified a common application joint cloud server that could be useful, identified with the platform. So a place where you can share for sure your experiences, your questions, but also you can share files, you can share documents, you can receive also support, and you can map European programs and receive news and updates about that. So this is my last slide. Do you have any questions or comments about what we presented?
meanwhile you are thinking, just I have to add one thing. So the hook to the next session is that will be presented by Sandy, but is in this time we have to think about what we see from the national focal point identicator and the organization. We have to think about how a platform can help in our work and what we can ask to have in the platform, what we can include, what we can need to have there, just to help for all the organizational and other technical skills or soft skills that we saw before. So the idea is today is a thinking tank. Okay, we have to put there our efforts just to create an instrument that is useful for all of us, and for the new one, for the old one, for all the people that are doing this, taking into account that is not the only role that one person has. So we have to optimize a place where we can really share things, where we can really understand what we need, and that's the aim of today. So today the idea is to create to have a look at what we really need, what we want to be there, and starting from what is already there or what was created. And that's the part that Sandy is going to do now, just to have the state of the art, where we are, and the next step is what we want and what we need. So yeah, it was just a comment. If there is some other comments, please jump in.
Thank you very much, Sarah and Christian. Also today there is also Pietro from ProMIS, and he is helping with, let's say, the technical adjustments. So he will be dividing us in the sessions later on. Before proceeding, I would like just to spend a couple of minutes because I know there are some new colleagues, for example, Raymond from Malta, on behalf of Vincent, right? Maybe you don't know us because we had the chance to know each other already, but I know you will participate in Rome, so you will have the chance to also meet us on site. Then there is, I think, a new colleague, Vendula from Czech Republic. Also, I don't know if, I don't think I've seen you before. If you want to introduce yourself, also Raymond, just take the floor. Good morning.
Good morning. My name is Vendula, and I'm a colleague from Matouš Duraj. He can't be available today, so I'm here. Maybe I will be participate on some parts of agenda. So that's it.
Okay, welcome to the team then. We are happy to meet you. Raymond, I don't know if you want also to quickly present yourself. We don't hear you. Maybe you have your micro off. Yeah. No, not working.
Hello.
Yes. Good
Okay.
morning.
Good morning.
Yes.
Good morning to everybody. I'm Raymond Schembri from Malta. I'm replacing Vince Bohajar today. Actually, I don't know nothing about the meeting, but he briefly told me something, and he gave me the form that you sent as well. And I'm enjoying listening to see what's going on actually.
Thank you very much. We will meet in Rome. And I don't know, Laurence, if you want to introduce yourself. I know you had the chance, but maybe some colleagues didn't meet you. I know you are the national focal point from Belgium. Everybody knows you, but maybe not who is present today.
Hello, I'm Laurence. I'm the national focal point since the beginning, since 2006. And we are associated partner here in the joint action, and we try to follow as much as possible all the activities. Nice to meet you all.
Thank you very much. And just to mention also, ProMIS is the affiliated entity of the Italian Ministry of Health that is leading the joint action. And today from the Ministry of Health, we have Daniela Plescia and Emanuela Vesperini. Okay, apologize. I didn't introduce you in the beginning, but I think now it was a good time. And I will again quickly show the platform. Thank you, Pietro, for indicating that in the chat. You have the link. I know this morning someone registered and it will be approved as soon as possible, but now I have logged in with not an admin account, okay, so that I can show you the platform and we can work together. Many of you colleagues have already seen it, so I don't want to take too much time on that. But again, we will have the chance to discuss it. I will share my screen. Of course, if you have any questions, please feel free. I think we are quite familiar now with the activities. Oh no, sorry. Okay, as you can see, so this is the welcome page. There has been an update, so we are constantly working together with Pietro on updating the platform. Of course, it takes a bit. It has been an intense process. It is quite complex, but we hope, of course, to take it to the best of the features till the end and to make the best of its use. These are the different sessions. You are logged in as users, of course, and the administration is led by the Italian team. So on the dashboard specifically, yeah, you will see a brief introduction of the sessions, and then the marketplace. So the session, the idea is to, of course, have the opportunity to upload and share, exchange relevant documents related to our work, but let's say in a more private space, because not all the information can be shared to the public. As you know, there is the website. We are constantly updating it also with colleagues from Work Package 2. Thank you for that. And together, of course, with the Italian team, but we believe that this was also the initial idea, so to have the space where to share any relevant document, also with regard to the initiatives that you are developing at the national level, examples, inspiration, ideas to create, to share and discuss further. For example, I know there is already a document that has been updated by Cara, so from Austria, so thank you. And as you can see, with regards, so very practical, again, we are very glad that we have the chance here to show it again and to discuss what we are doing. So we have updated the mailing list, so at least you can see the colleagues that they are joining if you need any email. Of course, this is constant updated by the Italian team, but for example, colleagues that are joining now from Malta and Czech Republic, I will make sure that you are also in here. And then we have updated the call scouting with regard to the learning by doing labs activity, for example. So you can find it here. This is a document listing all the calls also in relation with other health related programs, and it will be useful for the next activity that we are developing. It has been slightly on hold just because we wanted first to define the training module 2 on site, and then we will also be working on learning by doing labs. So everything is step by step going forward. And then the training session. Again, we are very glad to have the chance to update you that all the documents from the last training are here. So the presentations, and then the agendas, the summary report. Okay, we are trying also to update it with a summary report from the webinar, from the training online, in case you didn't have the chance. We believe this is an additional resource that might be useful for you. You can share it with your colleagues or other stakeholders once you have access to this information. Anyway, the training, As you've seen already, we are also organizing them live, and then we have the possibility then to rewatch them. So I know many of you have asked me if it is possible to disseminate to the colleagues. For us is yes, you can. Once you know the training is live on our channel, then you can of course disseminate, send the link. We believe it's just really useful information. So thank you for being so active, and thank you again for your participation. For us, of course, is important. And then again, also the presentations from Budapest are here. Again, I take the chance, I think there was colleagues from Latvia and Germany that they have specifically asked, so they are here in one file. Thank you, colleagues from Austria and Hungary, for supporting this, and the other editions as well. So as you can see, everybody, everything is here, but also on the website. Okay, I hope you really appreciate this as additional tools. And then and each time we are creating an event, and then once you create the event, you can create the resource. Again, if there is an event that you believe it is relevant for other colleagues to participate, an event that is relevant at the national level, but not only that, maybe it's organized in English, we can also work together here, update, maybe find the PowerPoint presentations. The idea, of course, is to try to not send so many emails anymore. So maybe again, this is really a useful tool, and we hope that we will start again to work on it. Agora, so this has been already discussed. This session is aiming at creating, let's say, a live interaction among us. As you can see, together with Pietro, we are commenting. We are also working on the notification, so that you receive an alert by email when there are new contents. And during the edition in Czech Republic, in Prague, during the training on site, I know there has been already some suggestions. Of course, the idea is to not overlap the content with other platforms. And I know for you, it has been already highlighted the need to have a place where to discuss specific questions with regard to the EU project management, about the information regarding the calls, and all the policy developments of the EU4Health program, and not only, maybe Horizon Cluster Health also, for instance. And again, we want to take the opportunity today to discuss if this is the case, to maybe better indicate, let's say, cluster of topics that then can be further developed in a way. The EU project database, this was a proposal from the Italian team, as we are also in Italy developing this database collecting all health-related projects at the European level. But we can say that we can focus on that at a later stage. And then the session Q&A also, the aim is not the same as Agora. Let's say we'd like more to, again, focus on specific questions that you can ask, and then someone can reply, or more of you, if it's a question that it might be useful for everybody. So this is, let's say, generally the presentation. It is also connected with the news from the website, as you can see, yes. And yeah, there is a directly connection actually to the website. So with activities, you come back here. Now, I think we can proceed with the session. If you agree, I will read already the questions, maybe, Sarah and Christian. And then when we enter the groups, we have them already anyway, but just, let's say, plenary, I will read again the questions that we would like to address during the interactive session. So we would like to ask, based on what we have discussed, also as a result outcomes from the report that Sarah Christian presented, and also with regard to the platform, what do you think is the purpose of this platform? Do you think it is important and useful for your national focal point role? What are the instruments, tools you would like to find in the national focal point platform, in addition on what we presented already? Which kind of support do you expect from the national focal point community? Again, I would like to highlight that we are a network, and we are also working on reinforcing our capacity and the network as well. Are you participating in other similar platforms? If yes, what is missing from them that you would like to have here? Okay. These are the questions, but again, we will see them. So I think we can proceed. I will just mention that the first group, there is myself as support to Natalia as co-leader, Natalia from Slovakia. Then second group, there is Sarah as a support to Jost and Leticia. Okay, and then there is Christian as a support to Daniela and Cara, and the colleagues then will be divided randomly by Pietro, and we have 20 minutes. Pietro will take the lead on informing us when the time is up, and then we will come back here and discuss the results. I think once you are redirected to the interactive session, you need to click OK. It might be like that as a window that pop up. Yes, okay, good. So see you in the groups, and thank you again for being here.